Hello, my name is Carly Brown, and I'm going to be going over our Module 4 assignment that is regarding the 50-year-old female patient that is brought in by EMS to the emergency department where she's combative, disoriented, paranoid, and has some wounds to her face and arm. So for the first question, what I believe the patient is suffering from is delirium tremens due to alcohol withdrawal. Based on the first impressions of the patient, it's suspected that she's going through alcohol withdrawal. This is a severely dangerous and possibly fatal condition, and it is likely that the patient is experiencing delirium tremens, which is commonly referred to the DTs. Longtime abusers of alcohol can experience this when they are going through withdrawal. Symptoms can include confusion, agitation, hallucination, anxiety, panic, and they tend to feel like there's a crawling sensation on their skin, and paranoia, which in this case, a lot of these things are happening to this patient. She's confused and agitated. She is paranoid that they are going to steal her purse, and she fell, so and she is having anxiety. So in the scenario, the 54-year-old female patient is screaming obscenities at a jogger, lost her balance and fell. So due to her combative, paranoid, shaking presentation, this is what led me to believe that she is experiencing delirium tremens. She also mentioned to the nurse that and physician that she needs another bottle, which what I believe is due to her alcoholism, and she's speaking about alcohol. So the short and long-term effects of alcoholism. There are many health risks that a patient will face when dealing with alcoholism. Patients with long-term alcohol use may experience health problems such as hypertension, heart disease, stroke, liver disease, and digestive problems. Mental health problems, including schizophrenia, depression, anxiety, are also common among different alcohol abusers. And alcoholism comes in many different forms. So there are, some alcoholics that tend to not have, not face many different risks or effects, and then there are others that all of these effects are associated with their alcoholism, and it can also lead to throat cancer, stomach cancer, pancreatic cancer. So there are many long-term effects that are associated with alcoholism. Some short-term effects that are associated with alcoholism and alcohol withdrawal include injuries. The patient, such as the patient in the story, she fell and injured her arm and face. Whenever you're out, drunk or under the influence of alcohol, you tend to have, reduced balance and more risky behavior. Some of the risky behavior can lead to sexual assault and other violent behaviors. With the shaking of the patient's hands and her combativeness, it has to do with alcohol withdrawal. So when patients are experiencing alcohol withdrawal, it's common to experience tremors or what people call the shakes. Long-term alcohol abuse can have a large impact on the brain when the body becomes chemically dependent on a substance such as alcohol. It can cause tremors and shakes when the patient is going through withdrawal. This shaking or the tremors is not typically life-threatening, but it can be very uncomfortable for the patient. With alcohol dependency, a person, like in the scenario that we are going over, and brain pathways have been altered over time due to suppression of the neurotransmitters due to the alcohol use over a long period of time. Can also lead to an overproduction of norepinephrine and serotonin, which can cause the shaking and other issues with the brain. So when alcohol is withheld from the body, these symptoms start to display, which is what you're seeing alcohol withdrawal. Assessments that are needed for this patient. In this situation, it would be likely that the patient is dealing with delirium tremens, which is, I believe, a psychological assessment may be necessary, as well as a full head to toe assessment, due to they most likely are homeless or have been neglecting their hygiene given that she smelled of urine and body odor. So full head to toe assessment may be necessary. It's important as a nurse to assess the patient and find out specific needs that the patient require in order to stabilize. It also may be necessary to do some lab work to determine if there are any other risk factors associated with her long-term alcohol use. Um, She's also has a scrape to her arm and face after her fall, so I believe that it would be appropriate to assess the severity of her condition and her wounds to determine how to treat those wounds. There's also a assessment called the Clinical Institute Withdrawal Assessment for Alcohol, which is also known as the CWA, and this is a 10-item scale to assess the levels of alcohol withdrawal that the patient is going through. So this assessment can determine the necessity for withdrawal management, which a lot of times withdrawal management is with benzodiazepines. So the score can range with the CWAS scale from 11 to 67. So, the higher the score, the more severe the withdrawal. So anything higher than 16 is considered to be more of a severe withdrawal. For the research question, management of mental health and health insurance. When it comes to mental health and management of various mental health disorders, treatment plans tend to be unique to each patient. So not all psychiatric medications work on everybody. It's not just black and white when it comes to the psych world. So in order to determine which medications may work for a patient, typically the patient will have to go through a trial and error period of medications in order to find the correct medication for them. Some medications work and some don't due to the way that they're metabolized in the body. So some medications that are for bipolar may not work for another person that has bipolar. Um, Given that the patients all metabolize these drugs differently, some drugs work for people that don't work for others for the same psychiatric illness. When determining which medication is appropriate and works best for the patient and going through a trial and error process, it can be difficult with insurance companies and getting them to cover certain medications. So this poses an issue for the patient. And the insurance companies want them to try every drug, the cheapest drug, the most commonly used drug before they go to the more expensive drugs, which psychiatric therapy and medications are not cheap. I believe that insurance companies should not be able to determine this because they're not assessing the needs of the patient or a physician. So the insurance companies are striving to find the cheapest route possible for the patient, and it might not always work for them. Another issue with insurance companies is being able to determine whether or not psychotherapy or talk therapy is necessary for that patient and determining if the patient is going to be compliant with that therapy. I believe that there's a lack of compassion and understanding when it comes to mental health and insurance companies covering this type of treatment therapy. This may be the only thing that helps the patient, but it's not cost effective for the insurance company, and it could be costly for the patient if they have to pay out of pocket. So if it's determined by the insurance companies, it's not medically necessary. They're just kind of out of luck. When it comes to insurance companies, their decision making is made through algorithms and profit margin, which can lead to the needs of the patient being unmet.